help them ensure that they're adhering to the regulations around quarantine. We ask that if they have symptoms of measles, that includes a fever, a cough, a runny nose, red eyes, or a rash, they're to call their contact number, and we will make sure that they get services immediately. We quarantine people to avoid increasing the numbers of cases of measles here in LA County. I want to give you an example about how quickly you can have a huge spread of measles. If you have one student at a university or college that exposes 1,000 people to the measles vaccine, in the 4 days before they know that they have measles, and you assume that about 5% of the population may not be fully immunized or protected from measles, you now will have between around 50 people who may in fact be easily able to get sick from measles, because 90% of people who are not immunized or haven't had measles before, when they're exposed to measles, are likely to get measles. If now you just assume 30 of those people become infectious, and they now expose about 500 people each, and we use the same ratios, within a period of weeks, we could have around 600 people with measles here in LA County. That's why we're so serious about trying to make sure that people who have been in contact with someone who has measles and are not immunized or cannot prove that they're immune stay away from other people. People who can be quarantined are obviously those people who cannot establish their immunity. That's either by showing us that they're fully vaccinated, and we require proof of that vaccination, or by showing us that they've had a blood test that establishes that they have immunity. I want to get to some numbers. At UCLA, there were 853 students and 7 faculty that were exposed to the measles case. Early on, we were able to verify that 729 students and 2 of the faculty members were in fact either immunized or immune. We issued individual quarantine orders to 124 students and 5 faculty members. Of those, currently 45 students remain under quarantine orders and 1 faculty member. All the rest have been cleared. At Cal State LA, there were 875 known students, faculty, staff, and visitors to the library, and an undetermined number of other folks from whom we have no identification. Of those, we were able to initially issue 215 individual quarantine orders, and those were to people who worked in the North Library. Since then, we also issued a blanket order that actually asked anybody who had been in the library on April 11th between 11 and 3 p.m. to self-quarantine, notify the health services, and establish that they in fact were immune before they exposed themselves to the public. Last night, we received another list from Cal State. They were able to go into the records of folks that had used the computers at the library between 11 and 3, and we've since then been able, through Cal State, to notify 660 people. These are both visitors, students, faculty, and staff that were in the library between 11 and 3, that they might have had an exposure to measles, and they need to report to health services to verify their status so that they do not need to be quarantined. At this point in time, we've cleared 215 of the 660 folks that were using the computers by just matching their names to the state registry and establishing that in fact they're fully immunized. Of the 215 individual orders that we've issued, 32 of those people have cleared, so we have another 183 people that are quarantined with individual quarantine notices. I just wanted to make sure everyone had numbers. That's the best information. I want to say those numbers are good as of this morning. We clear cases as rapidly as we can. Again, I want to thank all of the folks at both UCLA and Cal State LA for their cooperation in helping to really open up their health services and clear as many folks as we can. Obviously, we know quarantine's a hardship. We'd like to avoid it wherever possible, but we do need that verification that folks who were in contact with a case are in fact either fully immunized or we have an established blood test that shows that they have immunity. We're going to just quickly now open it up for questions.
How much of this is due to the anti-vax movement in America?
Oh, yeah. And before we'll answer that, but I just want to introduce the folks who are going to help answer questions. So this is Dr. Sylvia Prieto. She is our regional health officer. She will also be available to do interviews in Spanish afterwards. And I'm joined also, as you know, with our Dr. Davis, our health officer, and with Dr. Balter, who is our director of acute communicable disease control. So sorry, go ahead with your question.
How much of this is due to the anti-vax movement in America?
I mean, I think it contributes in some way. I mean, if you're not immunized, then the risk of being infected with measles, and as mentioned, 90% of those who are infected and aren't immune, will come down with the disease and they will expose others. But I will say that, that is something that is just fact. So no matter what your belief is, if you aren't immunized, that's going to be the risk. So I can't say, 100% is related to anti-vax, but those who aren't vaccinated are, can get the disease and pose risk for others.
But if we didn't see these numbers of folks, parents who were not vaccinating their children, would we be seeing these numbers of infections?
I can't say that specifically on all of that. Now, we do have to understand also that there are certain folks that have medical reasons that they cannot get, immunized. And so those folks are not going to be able to be protected. And we have to understand that everybody else who is immunized actually protects them. So they will be at risk as well. So I can't break down and say these are the numbers of folks that have medical exemptions and these are the folks that just didn't believe that they shouldn't get immunized.
So it's an inconclusive link?
What I'm stating is that if you're not immunized, that is the risk. No matter what the belief, even if you have a medical exemption and you cannot be immunized, people who are unimmunized are at risk of acquiring and transmitting measles.
And we definitely know we have more people who chose not to be immunized, and now we have an outbreak of measles. And obviously it's much easier to have an outbreak when you have increased numbers of people who aren't vaccinated.
Right.
These two students, the one who traveled internationally, I don't know if you can say or not, that person, did they go to Cal State or to UCLA?
We're not going to disclose that information.
There were some reports that there were new numbers of students and I guess faculty at Cal State LA that were exposed, but what you said is that
we just identified. There are no new numbers of people that were exposed, although, again, I want to also note that we've asked people to self-identify. Cal State has been great about doing sort of a major blast. So we might not have everybody on our list still that went into that library. What we do have, the new number is we have 660 people's names that we didn't have yesterday when we met and when we talked with the press yesterday. As of last night, we've been able to identify an additional group of people who we know were in the library. That's not all the people who were in the library between 11 and 3, but we're getting closer to being able to identify folks who were there.
For students who are, who are not, they were unable, they were quarantined, how difficult is it to obtain proof that you were, in fact, vaccinated?
Well, the universities in California, the Cal State and the UCs, do have a requirement of 2 MMR, evidence of 2 MMR immunizations as part of entry. So in this instance, as Dr. Ferrer mentioned, the California Immunization Registry is one place to look, and so a lot of people, can ask their provider, can you pull my records if they don't have them? We also have to remember that when kids are immunized, there's often a written record that is provided to parents, and that is also an official record. So we really do rely on the healthcare system in terms of either passing information and proof of immunization to the family or looking in the state registries.
But if it's required to show that you were immunized when you enroll, why were all of those students?
It's just a new requirement for
Yeah, it's
incoming
just-
students, which means transfer students and like the freshmen and women students. So the incoming class, and that was as of 2018 at UCLA. So yes, I mean we probably got very good coverage for the first year students, and we probably don't have either as good records or necessarily as good coverage for some of the older students that are on campus. But anybody who transferred in this last year or who's a new enrollee there actually did have to show proof of immunization, which is one reason why we're able to clear so many students so quickly.
Oh, but they were initially part of that initial quarantine.
Well, some of them were exposed. They might not necessarily have been, as I said, the number at UCLA was upwards of over 800. We actually only issued quarantine orders there for about 124 students. So we rapidly were able to clear because there were records.
Doctor, what kinds of legal mechanisms do you have to get people vaccinated in these circumstances? Because our understanding is that there are some jurisdictions where that is happening. People can get fined, cited. Is there any kind of legal mechanism?
I mean, we have, state regulations for school entry in that. I mean, typically, we're not sort of saying, okay, in this situation, you're required to go get an immunization. And in these instances, if someone isn't immunized, then we want to make sure that they're not going to expose others. So in many of these instances, it really is about you're not able to go out in order to possibly infect others. So, and also in this, if you're exposed, it's not after the fact that you're going to get immunized. That's not going to necessarily protect you. If it's in a short time frame, within 72 hours, that may give some protection, but it's not one of those instances where we would say everybody needs to go out and be immunized.
So the county doesn't really have a legal hammer to use in this circumstance to make sure.
In terms of an emergency response, I mean, there's sort of the school requirements, for employment requirements that are there that do require folks to be immunized.
Yeah, I mean,
we're
we're not forcing people to get immunized, but we are going to actually ask people to adhere to the legal requirements of a quarantine order. So I think Dr. Davis said this well. What we rely on is if you are not immunized, and we ask you now, actually require you now, to stay away from other people, you have to stay away from other people.
What's the penalty?
I mean, it's if we have to go to court because someone is not following an order, then we go through the legal system and figure out, what will happen if they're not following.
And I want to say, as of right now, we don't have anybody that's not adhering to the quarantine orders and is telling us they're absolutely not going to comply. We've had great cooperation. I think people appreciate the fact that there are very vulnerable people in our communities that cannot get immunized, especially infants under 6 months, and you wouldn't want to inadvertently expose somebody to a disease that can be devastating for both infants, pregnant women, people who are immune compromised and cannot be vaccinated. So I want to thank everybody who has received their quarantine orders, for actually adhering to the quarantine, and we're very hopeful in this case that we actually don't need to go to court or pursue any legal action because we've had a lot of cooperation.
When it comes to the self-identifying, are you getting cooperation in that as well, or are the numbers matching up?
We're going to get a report. We're in contact every day with the university. This would especially apply to the Cal State LA campus because we don't know everybody who was in the library. Cal State has reported to us that they have seen dozens of people at their health services. I don't have the exact number, but I do want to commend them for doing an amazing job on the outreach. So they've blasted it out via both email and notification all over the campus.
Because if I'm putting myself in somebody's shoes, could be scary, right? Being asked to self-identify. So what would your plea be to them in this moment?
You know, I think the truth is the vast majority of people on the campus have either been immunized or have immunity. So it's a very small number, and I want to emphasize this. It's usually, and in this case we know for sure, it's going to be a very small number of students and faculty and staff that actually aren't immunized. And it's pretty easy if they go to health services to have the folks at health services help them verify their status. If you can't produce your records, very quickly you can get a blood test, and within about 24 to 48 hours, your status can be verified. So, you know, we feel confident that most of the people will, in fact, end up being able to establish their immunity or that they're fully immunized.
I'm a little confused about the Cal State LA numbers that you're talking about. So you said that there were 660 possible that were in the library, 215 were cleared, 183.
No, let me start over, and I'm sorry if I was confused. There are 875 known people who were at the library between 11 and 3 on April 11th. Those are the people we know. The number is 875. That's students, faculty, staff, and visitors. Immediately, we were able to get a list of all of the faculty, staff, and students who work at the library. That list led us to issue 215 individual quarantine orders. That's from that 875 number. In addition, the remaining, should be 660, are the list that we received late last night of students, faculty, staff, and visitors who used a computer in the library during those hours. That's a new list, but it makes up that larger number of 875. Of those 660, we've cleared 215 of them just by being able to get their vaccination records off of the state registry.
And then the others.
The others are under a blanket quarantine order right now,
Okay, so
and will need to
there are
get cleared.
people just outstanding that don't know. That
Yes, there are. Those are the people we know. We know the workers, and we know the people who use the computers, and we know the people who checked out books, very small number. If you went to that library between 11 and 3 and you did none of those activities, you're not a worker, you didn't check out a book, and you didn't log on to the computer, we don't know who you are. You need to self-identify. But thanks for making that clear.
You know, I'll add on self-identification. Usually, you know, people want to find out their own risk. And so self-identification allows you to talk to a healthcare provider, figure out, you know, what's going on, or talk to us as public health, figure out what's going on, figure out how you figure out whether or not you're at risk or not. And at the same time, many people want to know, am I going to put my family members at risk? And so really, you know, it's really about providing information, you know, based on their situation.
So I would imagine 20 years ago, this department, much like every other health department across the country, was celebrating Measles have been eliminated from the U.S.
Yeah.
What's the feeling now? Is there just a frustration?
I don't think we're frustrated. I mean, I think it's a challenge. And it's not just a challenge for public health, it's also a challenge for providers. A lot of people, a lot of, you know, doctors that are practicing now that are younger doctors, they've never seen a case of measles. So they're also, you know, need to do a fair amount of learning, you know, to recognize the rash, to understand the symptoms, to set up their clinics to really minimize exposures to other folks. But yeah, I mean, it's a different time. We do have these outbreaks. I want to say it's fortunate that we actually prepare and practice for outbreaks as a local public health department. We have plans that we put into action, so it's not like we're trying to invent what we're going to do when we see an outbreak, because for some communicable diseases we actually have vaccinations that help people really reduce their risk, but there are others where we don't. So, you know, we're prepared for the worst scenarios as well.
What you were describing earlier, though, is what they call herd immunity, right? So that's how the outbreaks occur. Is this a breakdown of herd immunity, in your estimation, Doc?
Yeah, I mean, the more people that are protected, the less likely of disease transmission, which is why it's really important that those who could get immunized in order to protect, especially those who cannot be immunized. And so that's the herd. I mean, it's what you see with families with newborns. You know, when we talk about the rest of the family getting the influenza immunization in order to protect that infant, it's the same concept, but for the larger community.
Can I ask just very basically what your confidence level is right now with where this outbreak is and whether it's under control or you guys still have loose ends you're trying to...
Yeah, we cannot say definitively. I mean, I wish we could answer you. I can say we're doing everything we can. We have a lot of cooperation from the communities at both of these universities. I also want to remind everyone, although we've been focused a lot on the universities because these are settings where people are in very close contact with each other, we also do have other cases in the community. We continue to be, a port and an international destination. There's outbreaks all across the world and in other parts of the United States. So even if we managed to find every single contact here, managed to isolate everyone who came in contact and wasn't immunized, we still have enormous risk here in LA County, as do so many other communities, because there are outbreaks everywhere and because there's a lot of measles that's around.
So in real terms, for the rest of us, that means what? Avoid intimate contact or close contact like this room?
Get immunized. That's what it really means. It means if you want to protect yourself and you want to protect others, we have, in this case, a really good vaccine. 97% effective if you have 2 doses. 97%. That's a lot of protection.
Some of us only have the one, though.
If you have the one, you can talk with your provider about whether you'd be a good candidate for the 2nd dose. Obviously, if you're doing a lot of international travel, you may want to think about talking with your provider about getting that 2nd dose. But I do want to say there is a way for you to protect yourself, and that is to be fully immunized.
Do you recommend that people just go, people that are 40 or above, perhaps go and just get another immunization or get the blood test to find out if you have the
I'll give
increased?
this a shot.
So there are certain groups where it's very important that they have 2 doses, and those would be definitely international travelers, especially right now, as Dr. Ferrer said, there is a lot of measles in the world. Healthcare workers, anybody who works in a hospital, anyone who's caring for someone who's at risk for serious illness, such as an infant, someone who's immune compromised. You cannot get the vaccine if you are pregnant, but if you're a woman who knows you might be planning to get pregnant, you can get the vaccine as long as you wait 28 days before you try to get pregnant. So those are people who we would absolutely emphasize should get 2 doses of vaccine. For other people, what we're saying is when you visit your provider, you should ask your provider, do I have documentation of measles vaccine? If not, should I get another dose? Should I be tested? If you only had 1 dose, and it is true that there are many adults who only had 1 dose, it is not unreasonable to go ahead and get a 2nd dose now and maintain that documentation so you have it if you are exposed. Anybody who is exposed to a case of measles and doesn't have that documentation may be subject to quarantine. And also, if you truly are unimmunized or under-immunized, you may be at risk for measles, as people have pointed out. So it's not the level of emergency where everybody has to go to their doctor, but it's definitely something where you should talk to your doctor, and certain people, especially people who are traveling internationally, should get the vaccine. Even infants, if they're traveling internationally, the parents need to tell the providers and talk to them about what they can do.
What's the rate of seriousness of the current cases, hospitalizations, anything like that?
Some of the cases have been hospitalized and some have not.
How many?
I don't think we're going to give out that information today.
I want to go back to the question about outbreak. So in reality, the outbreak is among 4 cases, confirmed cases that are linked. The reason this has become big news is because two of those cases had contact with over 1,700 folks between them that could have been at risk, and that's what we've been assessing. So it's not as if, and we do have, a number of cases, 5 cases that have traveled through LA. So measles is out there, but we don't have widespread, documented cases and those people infecting others in this particular instance. We have 4 cases that are linked. The rest of them are not linked at all.
I'm going to just pause and see if there's anybody on the phone that had a question.
And ladies and gentlemen, over the phone lines, if you'd like to queue up for a question, please press star then 1 on your telephone keypad. And we first turn to the line of Michelle Ragavan with KPCC. Please go ahead. Your line is open.
Yeah, I wanted to have you characterize, all of us who are reporting about this are hearing from people who are concerned about risks of vaccination. We know that the vaccinations are safe and effective. Most of the time, it's very small risk to issues with the vaccination. But can you characterize the risk of a person not being vaccinated as opposed to being maybe getting harm from a vaccine?
Yes, measles can be a very serious illness, and because luckily, as others have said, in the modern era, we haven't seen a lot of measles. People forget that. 1 to 2 out of every 1,000 people who get measles will die of measles, either from respiratory complications or getting a brain infection called encephalitis. And another 1 in 1,000 will become brain damage from encephalitis. So these are very, very serious consequences. And around the world, we are beginning to see that again. The vaccine has been repeatedly studied and is safe and effective. Everything can have some risk, but the risk of measles vastly outweighs the risk of the vaccine, and that is why in public health we urge people to get measles vaccine. It's the best way to prevent measles. And again, measles itself can be very, very serious.
Is there another question on the phone?
Yes, next we turn to the line of Steve Gorman with Reuters News. Please go ahead.
Yeah, I have a bunch of questions, but I guess one I want to ask you is, I think we have 5 cases in LA County, is that right? Or
Yes,
there were 4?
we have 5. We have 5 cases. 4 are linked to each other. 1 is not. We have 5 cases in LA County residents. 5 additional cases we've been notified of people who have passed through LA International Airport.
Okay, and so of the 5 cases, I don't know, maybe there's 10 cases if you know. Do you know how many of those have been people who received 1 or 2 doses of vaccine?
Nobody of the 5 resident cases received 2 doses of the vaccine.
Did anybody receive 1?
Yes. One case received 1 dose of the vaccine.
So as we said earlier, if you receive only 1 dose rather than 2, you can still get measles. 1 dose is 93% effective, 2 doses is 97%, so 1 is good, 2 is better. The illness is likely to be less severe if you've had at least 1 dose of vaccine, but it's better to have 2 doses of vaccine, if you can, which is why we're recommending that people ask their providers. In addition, just a reminder, if you're traveling internationally, your risk is much, much higher right now. And so if you believe you've only had 1 dose or you are unsure, you need to make sure that you have 2 doses of vaccine.
And that was also recently recommended by CD Page, stressing that if you are an international traveler, 2 doses is better for you, given the number of cases of measles in other countries.
Right. And nobody who has been quarantined in the last couple of days has become ill yet, is that right?
No.
As far as we know, we have nobody who's reported illness. I want to remind folks that you're infectious 4 days before you get a rash. And many times, students, you think you're fine, and then you get sick, but you've been infectious for a few days before you showed any signs of being sick.
And just, I'm sorry, but the numbers are so mind-boggling. So the numbers of people who've been quarantined, who've been who at one time issued a individual quarantine notice at each campus at UCLA was 250, and it was 100.
At UCLA, we issued quarantine orders for a total of 129 people, 5 faculty, 124 students. At Cal State LA, we issued 215 individual quarantine orders, and then we have another blanket quarantine order for anybody who was in the library between 11 and 3. We know now that there are 660 people whose names we have who were in the library. The university has sent them a copy of that blanket order so that they know that they're under a quarantine order until they establish their immunity.
Okay.
But the numbers are very large, we agree.
So in effect, that quarantine in Cal State has been expanded from 215 just to at least to another 660 people at least.
At least, exactly. But they're not in, they don't have an individual order. They're covered by a blanket order that covers anybody who was in that library during that period.
Okay, but the individual is only
215.
Who work there.
Those are people who work there.
Right. Okay. Thank you.
Thank you. Any other questions in the room?
Again, if you talk about people that cannot get vaccinated, and your advice to them is just stay home. I mean, what should people do who, somebody sent me a question, if they're, doing immune therapy drugs and can't.
Yeah. That's a good question.
Well, for people who are not vaccinated, if they know they're exposed and come forward quickly, they can sometimes receive something called immune globulin, which can protect them from getting the illness if they can come forward within 6 days of being exposed. So it is to be aware. It's also to encourage the people they know and love and interact with to get vaccinated, because that is what protects everyone in the community. The measles vaccine will protect you yourself, but it will also protect your loved ones.
And I'd use this as an opportunity to also sort of plug, good sick leave policies that employers have, so that people who are sick don't come to work. People who have children who are sick are able to stay home and take care of their children. Part of what really protects people who can't get immunized is that they're not also exposed to people who are sick and feel like they have no options when they are sick. So, in this case, it's about telling people to please get immunized. But in other cases, these are the very same people who are also vulnerable for other infectious diseases. And we would encourage everyone, when you're sick, you need to stay home and seek care if you're very sick. Other questions in the room? I'll go back to the phone. Was there anybody else who had queued up on the phone?
Can you talk about the cost of vaccines? Please go ahead.
Sorry.
The people who were sent home from UCLA and Cal State LA, were they told at the time they were being sent home that they were prohibited from using public transportation?
Yes, the orders are very specific. So, yes, the quarantine orders make it very clear that you can't use public transportation.
Thank you very much.
And we have a question from the line of Sandy Lamont with CNN. Please go ahead.
Hi there. The original exposure at UCLA was April 2nd, 3rd, and 4th, correct?
No, it went later than that. I want to say
I think it's April 7th.
it's in April 7th.
I think the last exposure there was probably April 7th, but we're going to just check because we don't have that date in front of us.
Okay, and at Cal State, it was definitely April 11th.
Yes.
Yes.
Okay, and so my question is, why? A lot of these people that I'm talking with have just got their quarantine yesterday, possibly even the day before. Why so long?
Yeah, it's a great question. I think one thing we pointed out is you're exposed before a person becomes sick. A person becomes sick and doesn't always go in to see their provider immediately. And then once they see their provider, we've actually had cases here where the provider has not diagnosed it immediately. Then when it does need to get diagnosed, there needs to be lab testing that verifies that diagnosis, and then we need to find all the contacts. So, we try our best to go as quickly as possible, but you can see all along that there are places where there are going to be delays and where people are going to have had an exposure before we can let them know that they were in contact with a person that has a confirmed case of measles.
So in other words, you really don't know exactly how many visitors or others have been exposed.
Well, we have a very good list at the University of California, and we have very good tracking from that student about exactly where they were, and they were generally in spaces where we could identify the contacts in that space. But and we could go back on the campuses to all the days they had been on the campus during their infectious period. But you're absolutely right, which is why we appreciate all the messaging you're doing. There are probably many people with both of these cases, and certainly with some of our other cases, that have had an exposure and we don't know their name. And that's why we ask people to pay particular attention to where they were when we issue a broad notice that says, if you were at the library during this time, please self-identify. We can do that where we know somebody's been in a large public space, but we also try to tell people, find out your immunization status, get immunized if you can, and if you have any signs or symptoms and you're feeling ill, you need to talk to your provider. There's measles in our area and in our communities.
And the exposures were on April 2nd, 4th, and 9th was the last exposure.
2nd, 4th, and 9th.
Yeah.
Thank you. And last question. So several of the students that I've talked with today actually, well, maybe you've answered this, but they actually were immunized and the records weren't necessarily there, or their records were only partially there. What's going on with that? Is that because the parents aren't giving them the correct information and it's caught in the beginning?
I doubt that. I mean, I think what happens is, again, the universities just started requiring verification for their incoming class. So for those students who are new to that university, just enrolled in this last year, they've had to already show that verification, so the university has copies of that. I think for the rest of us, we're not walking around with our immunization records. And in this case, it took some time for some of those students to actually get to their parents, or for their parents to get to the pediatricians and actually secure the proof that they had been immunized. I want to remind everyone that the other route that folks are taking is to get a blood test to establish your immunity. So there are many of us who will never be able to get those immunization records, particularly those of us who are older, and we will have to rely perhaps on having a test to establish our immunity.
Thank you.
We have a question from the line of Kevin Tripp with NBC News Radio. Please go ahead.
Hi, I had a follow-up question. I know that the Reuters reporter also asked about specific numbers. I just want to make sure that we're getting the numbers exactly right. My questions are just about people who are currently either sick or under quarantine. This is what I had wrote down at the beginning. UCLA, 45 currently under quarantine in terms of students, and 1 faculty member. Is that correct for you?
That is correct. And that is as of this morning, so those numbers, as I said, moving target.
Great. And then Cal State LA, I think this is where it gets a little bit more tricky. 183 currently under quarantine, 660 that have been sent notices under the blanket quarantine, and then any and all people beyond that 660 who have been positively identified through computer records and book records. Anyone else besides that who was there on April 11th between 11 a.m. and 3 p.m. Is that correct?
I can give you a little bit of a better number. It's 183 people are under quarantine who received an individual order. We started with 215 people received an individual quarantine order. That's a quarantine order that comes with your name attached to it. Of those, we have cleared about 32, and we have 183 people with individual quarantine orders that remain in effect as of this morning. For the 660 folks that we identified last night, that the university identified last night, and sent them a copy of the blanket order. This is the order that covers everybody who goes in and out of that library, not an individual order. But of those 660, we have cleared 215, so there are 445 folks on that list of 660 that remain under that blanket quarantine order who we have their name. And then there is an unknown group of folks who are under that blanket quarantine order whose name we don't know and whose numbers we don't have. Those folks have been asked to self-report at health services. Does that help?
That does. So just to break it down, at Cal State LA, you've essentially got 3 groups currently.
Yeah.
Group number 1, people with individual orders, that's 183 people.
Yep.
Group number 2, 445 with notices under the blanket order.
Yep.
And the third group, an unknown number of individuals who were there in the middle of the day on April 11th.
And are subject to that blanket quarantine order. But we don't know who they are. So we can't tell you that number.
Oh, and one more thing. You mentioned at the beginning that there were 2 people who are sick with the measles. Did I hear that correctly? And is one person at Cal State LA and is the other at UCLA, or are they both at the same campus?
The 2 initial cases who were sick with measles, one was a case at UCLA and one was a case that was at Cal State. That was what that comment was in reference to.
Thank you.
And we have a question from the line of Lolita Lopez with NBC. Please go ahead.
Hey folks, thank you so much for this. I just wanted to follow up on the question about the legal part of legal requirements of the quarantine center, which I do understand. But in places like New York, they hold a public health emergency and pay fines and things of that nature. What is there a threshold for you all where that could happen here in LA County?
You know, I don't know that we have an exact threshold. Anytime we have a case, we try to identify both the number of cases that we have that are confirmed and also think through the number of contacts, et cetera, and really try to figure out what are the actions that need to be taken in order to protect the broader community as well as their contacts. That is a very unique situation where they are. There are significantly higher numbers of cases, but we are not in that situation at this moment.
And, you know, I want to emphasize, particularly on the campuses, we have very high rates of immunization. So it's a very different situation because we actually have known high rates of immunization.